Hello, my name is Dr. John Malcolm. I'm one of the robotic surgeons at Urology of Virginia. In this video, I will introduce the ERAS care pathway that we use for our robotic surgery patients. Surgery can be an unsettling experience for patients and their loved ones, with lots of uncertainty, physical, and emotional stress. Our goal at Urology of Virginia is to make surgery and surgical recovery as smooth and safe as possible, and the ERAS pathway is an important part of achieving this goal. ERAS stands for Enhanced Recovery After Surgery. The ERAS protocol guides patients and care providers through 3 phases of the surgery process: the preoperative phase, the intraoperative phase, and the postoperative phase. First, the preoperative phase. As with many things in life, preparation is key. Preparing for your surgery is important. Eat healthy foods in the weeks and days leading up to surgery. Exercise regularly to reduce stress and improve metabolism. Avoid excess alcohol and smoking. Smokers are encouraged to quit smoking at least 8 weeks prior to surgery if possible, but abrupt smoking cessation less than a few weeks prior to surgery is discouraged, as it can actually increase inflammation in the lungs. Blood thinner medications, such as high-dose aspirin, Plavix, Coumadin, Eliquis, and Xarelto, should be held for surgery. In most cases, you will need clearance from your cardiologist or primary care provider to get guidance on stopping these medications for surgery. Low-dose aspirin does not need to be stopped, unless your surgeon directs otherwise. GLP-1 agonist medications used for weight loss and diabetes, like semaglutide, also must be stopped before surgery. Discontinue these medications 1 week prior to surgery if your medication is dosed weekly, and 24 hours prior if your medication is taken daily. Preoperative labs will be ordered to ensure everything is in proper order. Be sure to get your labs completed at least 1 week prior to your surgery date, so there will be time to address any abnormalities. 8 hours prior to your surgery, you should discontinue eating and drinking, with one exception: a carb-loading beverage. An important part of ERAS preparation is the carbohydrate-loading beverage. Preoperative use of a carb-loading beverage reduces preoperative discomfort from fasting, improves insulin sensitivity, and reduces postoperative nausea and vomiting. Many carb-loading beverages are available, including ClearFast Pre-Op, Nutritia Pre-Op, Ensure Pre-Surgery Gatorade, or Powerade. You may drink any carb-loading beverage of your choice, but it is important to drink your carb-loading beverage 3 hours prior to your surgery start time. If you realize at the last minute that you have forgotten to drink the pre-op carb-loading beverage, it is best to just skip it, as consuming any liquids less than 2 hours prior to your surgery start time will result in a delay or cancellation of your surgery. If you have diabetes, you should drink G2 Gatorade as your pre-op beverage. When you arrive for your surgery, you will be given a preoperative antibiotic as well as an injection of a low-dose blood thinner to prevent blood clots during surgery. Second, the intraoperative phase. Your surgeon, anesthesiologist, and the entire operating room team follow ERAS pathway procedures to streamline your operation and prepare you for a smoother recovery. Warming blankets will maintain a constant body temperature. IV fluid management that is specific to your individual needs will reduce excess fluid buildup. Non-narcotic pain medications and anti-nausea medicines will reduce postoperative pain and nausea. Compression devices on your legs will further reduce the risk of blood clots. Third, the postoperative phase. Recovery begins immediately after surgery. Remember that you are not sick, you have just had surgery, and you are recovering. After a couple of hours in the postoperative care unit, you will be transferred to the hospital floor for your overnight stay. More and more patients are able to be discharged home on the day of surgery, and your pathway at home should proceed in much the same way as for patients who are admitted overnight. Within a few hours of surgery, your nursing team will assist you in getting out of bed to a chair, and by the end of the day, you should begin to walk. The earlier you begin to walk, the better you will recover. Early ambulation can reduce overall postoperative pain as well as postoperative nausea. It may be difficult at first, but each time out of bed gets easier. You will be given an incentive spirometer that helps you expand the lungs with deep breathing. You should take at least 10 breaths with the incentive spirometer every hour while you are awake. Deep breathing may prompt coughing, which is helpful for clearing the lungs and preventing fever. Holding a pillow gently on your abdomen during coughing can help to minimize discomfort. You should take your incentive spirometer home with you and continue to use it at home for the first 3 to 4 days after surgery. After surgery, you will be given liquids and advance to normal food intake as soon as possible, normally on the afternoon or evening of your surgery day. As long as nausea is minimal, you may eat and drink whatever you like. It is important to understand that nausea and vomiting are the most common adverse events after surgery, so do not be alarmed if these occur. Reducing nausea is a primary objective of ERAS protocols, and the following ERAS pathway ingredients are included mainly for the purpose of decreasing nausea: carb loading pre-op, tailoring intra-op IV fluids to your specific needs, reducing intraoperative and post-operative narcotics, early ambulation after surgery, gum chewing post-operatively, and post-operative stool softener. If nausea or vomiting occurs, oral, liquid, and solid food intake will be put on hold for as short a time as necessary. Medications like Zofran or Phenergan will be given to treat nausea if needed. Chewing gum between meals has been shown to reduce nausea and improve bowel function. You will be given sugar-free gum in the hospital, or you can bring a chewing gum of your preference. An oral stool softener will be given daily in the hospital and should be continued at home for at least a week after surgery. Postoperative pain control is a priority, and our ERAS protocol uses a multimodal, opioid-sparing approach to your pain control. During your surgery, you will be given injections of long-acting pain medicine in and around your surgical site. You will be given scheduled high-dose Tylenol around the clock, as well as scheduled NSAIDs, similar to ibuprofen, as long as your kidney function permits. Narcotic pain medications like morphine, Dilaudid, or hydrocodone can be used if needed, but these should be limited to the greatest extent possible because they can cause nausea, vomiting, constipation, dependence, and slow your overall recovery. Remember that you will have a certain amount of pain after surgery, especially when you start moving around and start your deep breathing exercises, but each day should get better. The morning after your surgery day, your progress will be assessed with review of labs and vital signs, and most patients will be able to be discharged home to continue their recovery at home. Continued ambulation, stairs are fine, and increasing activity, incentive spirometer use, regular diet, stool softeners, and limited narcotic use are ongoing points of emphasis in your postoperative pathway at home. After any robotic surgery, heavy lifting of more than 10 pounds and strenuous activity should be avoided for 1 month. In most cases, you will receive 2 new medication prescriptions for at-home use. 1, a stool softener, used for about 2 weeks. Bowel function returns slowly after robotic surgery, and in some cases it can take up to 5 or more days to resume normal bowel activity. 2, a pain medication. In most cases, you will receive 15 or fewer narcotic pills to use for the first 3 to 5 days after surgery. Over-the-counter pain medications like Tylenol or NSAIDs such as ibuprofen should be the primary source of pain control at home after surgery. I hope that this video has been useful in giving you a sense of the plan and purpose behind our ERAS care pathway at Urology of Virginia. We are confident that this pathway will help see you through to a safer and faster recovery and back to your fullest health. Please click on the link below for written supplemental information.